Hey, everybody, and welcome to this deep dive where we'll try to decode that nagging cough you might be dealing with.
Yes, we'll be looking at some insights from the National Institutes of Health, or NIH, as they're better known.
Right, and we've also got some great info from Medline Plus and FamilyDoctor.org.
So we're going to try to make sense of all this information about coughs.
And I have to say, I was really surprised to learn that coughing can actually be a good thing most of the time.
That's right. It's your body's way of getting rid of anything that's irritating your airways.
Huh. Interesting. So it's like our body has this built-in defense mechanism to protect our lungs.
Exactly. The NIH actually describes it as a reflex.
A reflex. Okay.
Similar to sneezing, but it's for your lungs.
So it's like a sneeze for our lungs.
Yeah, pretty much.
Okay, that makes sense.
Yeah.
But how do we know when a cough is just doing its job or when it's a sign that something more serious is going on?
Well, that's where things get a little tricky.
Okay.
Medline Plus and FamilyDoctor.org both talk about this idea of acute versus chronic coughs.
So is it all about how long the cough lasts?
Pretty much.
Okay.
An acute cough is a short-term thing. You know, it's there for less than 3 weeks and then it goes away.
Okay.
But a chronic cough hangs around for much longer, like 8 weeks or even more.
So if it's short, it's probably nothing to worry about.
Exactly.
But if it lingers, that's when we need to pay attention.
Right. You got it.
So Medline Plus mentions something called a subacute cough. Where does that fit in?
Well, a subacute cough kind of falls in between acute and chronic. It lasts somewhere between 3 and 8 weeks.
Gotcha. So it's like a middle ground.
Yeah, you could say that.
Okay. So we've got these time frames to help us figure out what's going on.
Exactly. It's like having a roadmap for your cough.
I like that. So if it's acute, it's probably just a common cold or maybe allergies.
Right. But if it becomes chronic, then we need to consider other possibilities.
And that's when it's time to see a doctor.
Absolutely.
All right. So the duration of the cough gives us a big clue.
Uh-huh.
But what are some of the most common things that cause coughs in the first place?
Well, our sources mention a bunch of usual suspects. Like you said, colds, allergies, right? Asthma even.
But isn't there something else, something people don't always think about?
You're talking about postnasal drip?
Yes, that's it.
Both FamilyDoctor.org and Medline Plus mention this.
Postnasal drip. Oh man, that's not a fun one.
No, it's not. It's basically when mucus drips down the back of your throat from your nose.
Oh.
It can be really annoying, and it often triggers a cough.
Why does that happen, though?
Well, your body senses that something is irritating your throat.
The mucus.
Yeah, and it tries to get rid of it by coughing.
So coughing is actually a good thing in this case.
It is. It's your body's way of protecting itself.
Wow, our bodies are pretty amazing.
They really are.
So we've talked about colds, allergies, asthma, postnasal drip.
Right.
Well, let's talk about some of the more serious conditions that can cause coughs, like bronchitis and pneumonia.
All right.
The NIH says that both bronchitis and pneumonia involve inflammation,
Uh-huh.
but they affect different parts of the respiratory system.
That's right. Bronchitis is in the airways that lead to your lungs.
And pneumonia is in the lungs themselves.
Exactly.
So knowing the difference between these two can help us understand what's going on and what kind of treatment we might need.
Absolutely.
The NIH mentions that a low-grade fever often accompanies bronchitis, but with pneumonia, the fever is usually much higher.
That's true.
So that temperature difference can be a clue.
Yeah, but it's not a foolproof way to diagnose yourself.
Right.
The only way to know for sure is to see a doctor.
They have the expertise and the tools to figure it out.
Exactly.
The NIH also talks about how doctors use stethoscopes to listen for certain sounds that indicate pneumonia,
Uh-huh.
and they can also take x-rays to get a clearer picture of what's happening in your lungs.
It's amazing what those tools can do.
It really is. They can help pinpoint the problem.
And that's especially important when we're talking about more serious conditions.
Because there are some red flags that we should never ignore.
You're absolutely right.
All of our sources seem to agree on that.
Yeah, they do.
Things like coughing up blood, unexplained weight loss, difficulty breathing, chest pain, high fever.
Those are all serious symptoms.
And if you experience any of them, you need to see a doctor immediately.
Absolutely.
Don't wait. No toughing it out in those cases.
Oh.
So let's shift gears now and talk about treatment.
Okay.
Our sources mention a variety of approaches, but it seems like the main idea is to treat the underlying cause of the cough, not just the cough itself.
You got it. It's about finding the root of the problem.
Like solving a puzzle.
Exactly. You need to find the missing piece.
For example, if your cough is caused by a bacterial infection, like some cases of pneumonia,
Then antibiotics are the way to go.
but if it's a virus, antibiotics won't help.
Right.
So it's really important to target the source of the issue.
Absolutely.
FamilyDoctor.org also mentions treating allergies or acid reflux if those are the culprits behind the cough.
And they also point out that some medications can actually cause a cough as a side effect.
Really?
Yeah, like ACE inhibitors, which are often prescribed for high blood pressure.
Huh. I didn't know that.
If that's the case, your doctor might adjust your medication to see if it helps.
So it's important to be aware of all the possible factors, even medications.
Absolutely.
The key takeaway here is to work with your doctor to figure out what's causing that nagging cough and address it directly.
Right. Don't just try to mask the symptom.
Now let's talk about some lifestyle changes and home remedies that can help manage a cough and make you feel more comfortable.
All right.
All of our sources have some great advice on that front.
Yeah, they do.
Simple things like staying hydrated by drinking plenty of fluids can make a big difference.
It helps to thin out the mucus.
So it's easier to cough up.
Exactly.
Using a humidifier can also be helpful, especially if the air is dry.
That's right. Adding moisture to the air can soothe your airways and make breathing easier.
And of course, we can't forget about the big one, quitting smoking.
FamilyDoctor.org is pretty clear on that one.
If smoking is contributing to your cough kicking, the habit is essential.
It's one of the best things you can do for your overall health.
So we've covered a lot of ground today. Understanding what a cough is, different types, common causes, when to see a doctor, treatment options.
We've even touched on some lifestyle changes.
But it feels like we've only scratched the surface.
We have. There's always more to learn.
But one of the most important takeaways, I think, is that our bodies are constantly communicating with us.
They are. They're trying to tell us something.
It's like they're trying to tell us a story.
Exactly.
And a cough might be annoying, but it's often a message.
Uh-huh.
It's saying, hey, pay attention. Something might be off here.
Right. So we need to listen to our bodies.
And learn to decipher those signals.
Precisely.
Pay attention to those coughs. Don't ignore them. And don't hesitate to seek medical advice if something feels off.
Knowledge is power, especially when it comes to our health.
Absolutely. And we always encourage our listeners to do their own research, become informed patients, and ask their doctors questions.
Because the best decisions are made in collaboration with your healthcare provider when you have a good understanding of what's going on with your body.
So the next time you hear that nagging cough, remember what we've talked about today. Think of it as your body's way of saying, let's team up and get this sorted out.
Maybe you'll even impress your doctor with your newfound cough knowledge.
Until next time, stay curious and stay healthy.